second video is going to look at different mobility assessments that I would do for a foot and ankle. So first is the posterior talus assessment. So what I would do is I would, feeling for his lateral medial malleoli, I would come just approximately to that to lock down his leg. And then I would also lock down the talus, and I would apply an AP glide to check for posterior talus. And I can do it bilaterally, so that way I can get an idea of any congruency. All right, go ahead and lay on your side. This next assessment is for rear foot, so just for ease of my patient, I'm not going to have him flip over for the same foot. We'll just do one on each side. So if his medial malleolus is facing up, this would be a lateral glide. So what I would do is I would wrap around the talus to lock it down. Using this hand formation, I would then grab onto his calcaneus, and then I would apply a lateral glide, ensuring that I don't just put him into push him into eversion. It's a straight downward glide of the calcaneus. Okay, go ahead and switch. And then if his lateral malleolus is facing up, this would be a medial glide. So once again, just locking down that talus, same grip for the calcaneus, just applying that downward force for a medial glide. Okay, go ahead and land your stump back. So this next one is for midfoot. All I'm doing is locking down that calcaneus and just moving him into inversion and eversion, checking for any symptom provocation, as well as any just general mobility. Any pain?
Sure.
Okay. And then lastly, for a first MTP assessment, I wrap my hands around that first metatarsal, and then following the concave convex rules, if I would want to promote dorsiflexion of the big toe, I would just glide superiorly. And if I wanted to promote dorsiflexion or plantar flexion, I would just glide inferiorly. And those are a couple examples of joint mobility assessments for the ankle and foot.